Hello everyone, my name is Garrett Murren and it's my pleasure to be here with you today. I'm joining you from Vancouver, Canada, and I work at Radiant Life Technologies as the regional manager for North America, and I've been with the company for a decade now. Now today I want to present to you in a practical way, that's why it's a workshop. I want to present to you coMra therapy. Now this is a breakthrough medical technology that was developed by Radiant Life Technologies in 2009. I'm excited to share this with you today because after this, let's say 10 years of experience in clinic and around the world, we believe, well actually I'm convinced that coMra therapy can help so many people with eye conditions, with vision challenges around the world. And so everything we do at coMra therapy, at Radiant Life Technologies, that we do with coMra therapy is aimed at holistic self-sufficiency. Now, big word, but I'm going to get into what that means in the presentation, in the workshop. And our mission is really to help people to help themselves. So today what we're going to do, as I said, is a workshop. So we're going to approach coMra therapy in a very practical way. Excuse me. We're going to look at the coMra Delta, which we have here. This is how we're going to look at coMra therapy through that context. And we're going to do that obviously focusing on vision. And we're going to expand out from there to associated treatments, because things that happen in the eye are not necessarily isolated to just the eye. And we're going to use real life examples to go through this. Now, and we're also going to go through treatments, and I meant to mention where my mouse is here, and if there's time, you see I have a few accessories on the side. I want to just walk through those so you understand a little bit about that as well. Now, I have my slides here in front of me, the same as you're looking at, so I'll be clicking through them. We'll go to the next slide right now. Before we get into the practicalities, I want to talk about the coMra approach. Excuse me. So now, for us, we see this body, all bodies, as highly evolved, intelligent life forms of their own. In other words, the body's been evolving for untold centuries, millions, billions of years, however it's all worked. And in that, it knows exactly how to heal. In fact, it's always healing. It's just that it lacks the certain support, resources, and different things necessary in order to do that sometimes. And so it still needs support. And this is where you come in, and this comes back to that holistic self-sufficiency. We start to treat ourselves to look after our own health. So this is one part of it. And the other part of this is coMra therapy is a highly advanced, it's actually a highly advanced technology that interfaces, that interacts, that supports that inherent ability of the body to heal itself. And it does this non-invasively, which means it's inherently safe to use. This is also very important. We don't have to force the body. We don't have to open it up. There's a lot we don't have to do when we support the body's intelligence rather than push that intelligence out of the side, push it aside and take over. Now, with that, excuse me, the other thing that I wanted to mention is, and let me just try it this way to give some context. One thing I want you to take away from today is the applicability of coMra therapy to not just eyes. And I'm going to share with you why that's so. And this has happened more than once, but I just share one story, obviously. I checked in with a client who purchased the Delta through a doctor, and I'd asked the person, how's it going? It's a long story how we got to that, but anyway. And she said, I haven't used it since I got it, and it's been a couple of months. And I said, oh, okay. And she said, well, I've been in a big car accident, so I wanted to get better before I started using it. And I'm on the other side of the phone and my head just drops down. And so why I want you to get this today is so if you decide to go forward with coMra therapy, you'll understand a little bit more. I'm not saying understand everything, but understand a little bit more how you can use this for associated things or other things. So we're going to go through that a little bit when we get into treatments. And also a bit of the context and for the workshop and everything we do is because a lot of times in people's lives coMra therapy is actually underutilized, and of course that first story relates to that, because at the end of the day my, let's say, goal with this workshop, actually with everything I do with the supporting people to help them help themselves, is periodically I get this call, and this is the call that really makes my day beyond anything else. It's that call that says, "Hey Garrett." And I say, "Hey, how's it going?" I finally get it. And I say, "Great, get what?" And now I've been doing this for over 10 years now, so I have an idea what people are talking about. And they'll say, "I finally get it. I didn't know I could do so much to look after my own health." And this is really what coMra therapy is about. So that's a bit of the context. There's a lot more we could say, but for now we'll leave it there, and we'll touch on different bits and pieces as we go through the device and the treatments and the how-to and these kind of things. But now let's go to the next slide, which is about the learning objectives. So what we're going to learn about the coMra Delta device. We're going to learn a little bit about the safety, like I said, the treatments, and we're going to use those real life examples. Okay, so now we begin with the practical. Let's start with the coMra Delta. So we have the case that it comes in, and I'm just going to open that up, and you'll see here, this is what comes in the case. First, we have the coMra coaster. Okay, there's some technology in here. We'll get into that more later if there's time. And next we have, and this is very important, this is the USB stick. Now, this user guide is on here, and it's in multiple languages: English, French, German, Spanish, Russian, Chinese, many different languages. And you can get this printed at your local office, supply store, small volume print shop for around $30. Easy to do. Just take the USB stick into them. They can do that for you. You can also download it from the website, but we'll show you those links and stuff later. Actually, I can show you now. Here, look. If you look here, you can download it from the website. Yeah. So next we have a very important piece of kit. This is the battery, the battery for coMra therapy. And we'll get into that. Next we have the wall plug adapter. So USB on this end, power plug into the wall. Excuse me. And following that, we have the car charger. So you can charge the Delta battery. You can run the Delta too, actually, off the car adapter. And next we have the Delta itself. Now this is two parts. First, we have the handset, okay? And I've got the cord already at length for us to use here today. Oh, and one other piece I didn't tell you about. You'll get this charging cord. So this is what you use to charge. Actually, before we get into the Delta, I'll show you how to charge the battery. So this big end goes into the wall plug adapter like that. This small end plugs into the battery. Now where to? You'll notice this is the logo on the side from the logo. Right here is where it plugs in. The small end goes in. It can only go in one way. If you reverse it, you just have to flip it back. Okay, plug that into the wall. and you're charging. Yeah. So you charge the battery. There's an indicator light here that'll come on red when it's charging. And when it's done charging, it'll be blue. Okay, so we can take that out for now. You can also run the Delta. You can plug the Delta directly into here. Or if you're camping or traveling, you can plug it into here. Of course, you can also charge the battery with the car adapter. Okay, so we'll leave that there. Now next, back to the Delta. This is the handset, and this is the terminal. This one happens to say medical terminal, okay? So what you do, let me lay that end down. When you first get the Delta, there'll be a tight fit to plastics. So you just put it together like that, and the USBs inside have to line up. So usually when you put it in, it lines up pretty good, and you just stick it in like that. Now, next thing you'll want to do, and remember I said simple and easy to use. 1, 2, 3 buttons. So you can't get much more easy than that, and we're going to go through the user guide and you'll see. So with the battery, you're wondering, well, where do I plug the Delta in? Here's the label. On this side, there's a little gray tab. So if I pull up on that with my finger, then I can open this up, and inside here is where the USB for the Delta goes. So let me hold that down so you can see, and we'll just plug the USB into here, and notice how the blue light is there, and one light is on here on the Delta. So press and hold for 2 seconds, and then the Delta lights up. So let me show you that again. And press and hold for 2 seconds. All you see is one light right here. Press and hold for 2 seconds, on. Now to start a program, press and release. So it's on right now, and I'll turn it around. You can see some lights flashing. So I'll go through that while it's flashing. Sequence colored LED therapy, infrared laser therapy, ultrasound therapy, and magnetic therapy. This is the therapies combined in coMra therapy. You would have seen that in the other presentations. So the workshop, we're not going to go into that in any detail. So right now, you see some lights lit up here. It's on. When it's done, it'll do one beep for on and 2 beeps for off. So if you listen, we're going to turn it off. 2 beeps off. So when you're using it, you'll hear 2 beeps when it's completed. When you turn it on, 1 beep. Now press and release for if it's running in a program and I want to stop it, press and hold the button, and you get 2 beeps. Press it once, press and release for on. Press it once. Now you see the on and off button getting brighter and dimmer, brighter and dimmer. If you press it once, right now what's happening is it's paused. Remember the old VCRs for those around in that era? This is the pause. So you can, let's say you had it on a 10-minute treatment and you're in the middle of it and the kettle went and you wanted to get the kettle but you didn't want to start over. You can just pause it, go do what you need to do and come back. Now while it's in pause, you cannot change any buttons here. You see that? Nothing will change. So press and release to resume the program. So it's back on again now. Press and hold, and when it cycles out, when the timer turns off, it'll turn off and you'll hear 2 beeps. So I'm just going to let it run for a second while it's running. You'll notice I can't do anything with these other buttons while it's running. Okay, so still going, and we're on a minute right now. On this side is the frequency selections, and on this side is the time selections. This bottom button is the ultrasound, and of course this is the on and off button, as we've gone through a few times now. That's all the buttons that's on the Delta. I mean, it's very simple to use, and in the user guide we're going to go through, and you just heard it turned off on its own. So when you're, let's say, watching TV and you got it on your you're treating around your eye or on your eye directly. If you're treating your eye, obviously you're not going to watch TV, at least not with that eye. Hopefully you'll take a break from the TV while watching, at least not with that eye. So next thing we'll go through is the frequency and time setting. So this on this side is an hourglass. So you'll notice at the bottom you have 1, 2. Now you'll notice that the delta just went off. Batteries now, I don't know if everybody's aware, but they had fires on aeroplanes, and since they've had fires on aeroplanes, they've changed, and the batteries, it started from, I think it was mobile phone batteries. So since that's happened, battery technology now, because we used to have a battery, you just turn it on and off, and as long as you turned it on, it would be fine. But battery technology now, it has to turn off automatically after 5-10 seconds. So if you have the so all you need to do, and what we're going to do now, you release, just unplug it, wait 5 seconds, plug it back in, and you'll see the light in the center is back on. Press and hold. Now the device, press and hold for 2 seconds, device is back on. So on this side we have the time settings. So we're going to go through, so there's 1 minute, 2 minutes, this is 10 minutes, sorry, let me start at the bottom, that's 1 minute. The second one is 2 minutes. The third one is 5 minutes. And the top one, the fourth one, is a 10-minute setting. So on this side we have the frequency settings. So what you're going to notice, now I just started it, it's running. You cannot change any settings while the delta is running. Okay, so right now I just turned it off. You heard 2 beeps. Now we can change settings. Okay, so this side is frequency, and we're going to get into what those are about. So this is 5, 50, 1000, and variable. So variable means it cycles 5, 50,000 pause, 5, 50,000 pause when the program runs. So if I turn it on right now on variable, this is cycling. Okay, now ultrasound, you can only change that, just like the time and the frequency buttons, when it's not running a program. Now you can change it. When that button is lit up, that means ultrasound is on. When this button is off like that, that means the ultrasound is off. Okay. So that's pretty much it for how to operate the delta. The next thing we're going to look at is placement on the skin. So I'm just going to show you directly on my eye. So I have it on 5 minutes, 5 hertz. And I'm going to always, when you're treating your eyes, and we're going to go into this more, I'll show you on the screen, on the slides and stuff, but when you're treating, actually I'll show you on my hand because then I can look at you at the same time. When you're treating on the skin, anywhere you're treating with the delta, you're just laying it on the skin. A scanning treatment, I'll just close my eye and show you scanning. So when you're scanning, it's just slowly across the skin like this, okay? Because there are some treatments that are scanning. I've seen some people and they're like this, so not like that, but relaxed. So the whole thing with coMra therapy, one of the effects is it's going to relax you. So when you're treating, some people who treat, you're going to start to improvise after a while. But anyway, a stationary point, a scanning point. And you'll see here on the diagram, I'll put this up on the slide, what the difference in a stationary point is and what the difference in a scanning point. Okay, so let's lay the delta down for now. I'll just lay that here. Unplug it for now. Now if you have it in your home, let's say by your bedside or at your coffee table, or if you're in a practice and you're using it all the time in the same room, just leave it together. It's very simple that way. If you're traveling, I recommend keep the case because it'll protect it. You know, you got the foam, it's inside of there, so if you drop it or anything happens, nothing's going to happen to your delta. If you're traveling, of course, you don't want to take the foam case because of, you know, weight or volume when you're on the plane, then roll it up in a towel, take it apart, roll it up in a towel and put it, or in a shirt or some of your luggage, so it's inside and not at the very edge, so it can get, sometimes our luggage gets bounced a bit accidentally, perhaps. So that's pretty much it for the Delta itself. And now the next thing to talk about is safety. So as you see here, two basic safety things that must be observed: eyes and pacemakers. So let me talk about eyes first. Don't shine the Delta into your open eyes. Your eyes have to be closed for treatment, okay? That's it. So then think about it. If you're in a room and there's mirrors and stuff like that, and children and dogs, just be aware of where you're shining the Delta. You don't want to shine it in anyone's eyes. Of course, the further you are away, anyway, you don't want to shine it into anyone's eyes. And the second is with pacemakers, and this is with respect to the magnetic field in the Delta. So let's say people usually get a pacemaker here, so about a foot away from the pacemaker, depending on where they put it in their chest or shoulder. So you can treat the eyes. You don't want to be treating this area. You can treat over here. You can treat, down here, say 30 centimeters. I've had people report, look, they're working with their cardiologist and they don't have a problem with them using the Delta, or cardiologists say, no big deal, but not enough research has been done with respect to magnetic fields and pacemakers for us to go any closer than, let's say, 30 centimeters or 12 inches for a very big safety factor for people. Now, when it comes to transplants and these kind of things, also we say, look, when it comes to heart transplants and artificial valves along with pacemakers, we're going to err on the side of caution and say, if you're doing this at home, you need to work directly with your doctor or cardiologist to give you the go ahead and monitor your progress. We're going to say give it a pass if you're on your own, because not that there's any safety risk, but there's not enough research in the literature for us to go put a stamp on it and say we're totally confident. We do have people using it in the case of transplants. However, they're working with their physician. We do have and the professionals, well, they know what to look for. So enough said about that. There's other safety precautions, and this is to do with, let's say, when you're doing treatments. You're going to see this in the beginning of each section of the user guide. There will be warnings or any kind of notifications related to that section. For instance, at the beginning of each section, you're going to see one that says, only treat your heart once a day if you're doing multiple treatments. Now, some people with eye conditions also have heart conditions, high blood pressure, angina, all kinds of things. So when you're treating your heart, let's say you're doing two different treatments and both of them call for treating the heart, you'd only do it in one of the treatments, okay? So this is another one of the safety precautions. And like I said, the main thing is pacemakers and eyes. Of course, sounds funny, we're treating the eyes, but be careful. Eyes closed. Excuse me. When people first start out, what I usually will recommend is that not only eyes closed, but look down, because it takes a little bit, sometimes it takes people a little getting used to. So if they're looking down, if they happen to inadvertently open their eyes, then they're not going to shine it, because it's not about the eye, it's about shining it through that lens when the eye is open, because the lens focuses, okay? So gaze down or to the side, and that's about it for the safety for this moment. We're going to maybe touch on one or two things as we go through some other aspects. Okay, so now we'll talk about the user's guide. Now, there's a lot of stuff in the user's guide that's extremely important in one section. That section is called the before you begin section. So I want you to make sure, if you go ahead with coMra, I hope you will, for whatever fits for you anyway, you need to look at this section periodically. There's a lot of valuable pieces in here. It's going to talk about care of the device. It's going to talk about how coMra therapy works. It's all done. It's only a couple of pages. It's very, very condensed amount in a most simple form of information that anyone can understand. So cleaning, what you're treating when you're treating with coMra therapy, what to expect, how treatment, like how healing works, vitality and lifestyle as well, different, what the frequencies mean. And just a note about the frequencies, since I didn't talk about it earlier, if you think of music, you can think of the frequencies in coMra therapy, and we're going to look at the frequencies as we go into these treatments. Think of music, the bass note is the really low pitch, and that's the 5 hertz, and that penetrates the deepest into the body. Just like if you see or hear the bass music, you can feel it penetrate the deepest into your body, compared to the treble, which is the really high notes. Those ones there, those are the least penetrating, and that would be the 1000 hertz setting. And then 50 is the mid-range, and they all have their application. And of course, as I mentioned before, there's V for variable, which has its application as well. So in that before you begin section, there's a lot of valuable information. I won't go through each thing right now, but I really, even if you're not going ahead with coMra, but you're only curious, you can download that, and you see right here on the page, this is where you go to download it. You press that button. It's very simple. Then you can just read it, because you can get the whole user guide, like I said, downloadable. That's free on our app, and you can get it either in a PDF, which means you can go get it printed, or you can get it as an app for your phone or your tablet, all downloadable for free. So I advise you to make a use of that if you want to get more familiar with coMra, relaxed in your own home type of thing. Now, the way the user guide is laid out, and I'm just going to pick it up and we'll leaf through it, and I'll show you as I go. I'll show you on the screen. In the very beginning, you have the table of contents, and things are laid out there more or less. You have it laid out in sections. So at the beginning, like I said, before you start with the safety precautions at the beginning, then we get into universal treatments. Then we get into the traumatology section, and that's all to do with joints, tendons, ligaments. So knees, shoulders, back, elbows. Then we get into ear, nose, throat, and so on. And for you with eyes, there's going to be 2 sections that are going to be most important, directly to do with eyes. That's the neurology section and the universal treatment section. So neurology section anyway is section 12. It's in the book. You can easily find it. Same with the app. You can type it in. Next, that follows the table of contents is we put the index at the front. Now, in here is a list of conditions. It's not an exhaustive list. I mean, yeah, we'll just give you, let's say, if you take, there's a knee treatment, or let's stick with the eye. There's an eye treatment, and we're going to show it in a minute here on the slides. Well, we can show it here. We'll show you in a second anyway. The eye treatment. You'll see it lists macular degeneration, retinitis pigmentosa, and glaucoma. It doesn't mean these are the only things you can treat with it. It just gives you an idea of what you can treat. Now, the reason we did that is because if we put a list of everything under eye conditions, we'd have to list a lot of different things. So, and it's the same with all the other parts of the body. When you look at the Neurology 14 treatment, what you're going to notice is that on one side of the page you have, it says section 12, Neurology 14, but above that you're going to notice a big exclamation point. And anytime there's something we really want you to pay attention to in the book, on the app, we're going to put an exclamation point with a note there, and it says ensure your eyes are closed for the treatment. So that's very important, and it'll be there for whatever type of treatments. If there's a note, there's only a couple that you need to pay attention to. Then underneath the section and the treatment, like I said, you see what it's for, which is glaucoma, macular degeneration, and retinitis pigmentosa. Anything actually to do with the eyes. So let's say you had a herpetic infection that was affecting your eye. It's for that. Let's say you had conjunctivitis. It's for that. Let's say you had eye tension and strain. It's for that. Anything to do with the eye. Okay? It's going to be for that. Just like if it didn't say knee pain, but it was said knee arthritis, you would use the same treatment for both. Okay, now the next thing you're going to notice is this list, and on the list it'll show you on the one side you have the treatment point, then across from that you'll see the hourglass, which is the time, and then next is that symbol which is for frequency. So you'll see point 1, time, frequency. So in other words, for point 1, you put it on the eye with the eye closed, of course. Here, I'm just going to put it on here. On the eye, eye closed, and the settings are on what it says, and it's going to be for the 50 hertz for the 2 minutes each eye. Okay? And I'll actually demonstrate this for you. Again, we turn the delta on. So we have it set for 50 hertz. And we have it set for 2 minutes, and now we're just going to close the eye, place it on the eye, and it's that simple. Okay, so we're doing the treatment, and then the next point is going to be, I'll just stop it there. The next point is going to be actually a scanning point. So you see the number 2 on the mannequin lines up with the number 2 on the treatment table. And so what you're going to do, this is the scanning I mentioned earlier. Once again, I'll demonstrate. So this is 5 minutes aside. So right now what we need to do, we need to change from 2 to 5 minutes aside, and we can turn it on back here. Now I'll often recommend to people, you know, if it's just you in the room, I don't like to turn it on right next to my ear because the beep, my hearing is very sensitive. So if you turn it on down here, and you just come up to the side, and then scanning, eyes closed, and we're scanning along the optic nerve here. So if you think about it, you're treating the damaged tissues directly, and you're treating the organs and tissues and systems that support that area of damage. And sometimes if I have my arm laying on the couch, I'll move my head instead of the machine. Split up the work. So yeah, that's basically, it's that simple to do treatments. Okay, now in here you're going to notice, and I didn't talk about this yet, on the side we got, it says how long the treatment takes, what terminal to use, and below that it says ultrasound off, and it's saying ultrasound off for point 3. Now point 3 is the occiput on the back of the head. This is where your visual cortex is. So you're going to, I'll just turn around. So you're going to put the delta, well, I'll just do it. So 50 hertz, we'll just put it on there, stationary point, so you can see, okay? And when you're looking at it from the side, it's the big bump on my head. So that's the occiput right there. So I'm going to put the delta back down, turn that off. I leave the ultrasound on. When and in the book we have it off. Ultrasound, more and more research is coming out to show that the type of ultrasound in coMra therapy actually is hugely beneficial for the brain, in the sense of getting rid of those plaques and these kind of things that are associated with Alzheimer's. So we started with our CE certification, we had to say ultrasound off, so we stick with that. I turn it on, lots of people turn it on, doctors turn it on. in the book we say ultrasound off. So this is how the treatment works, okay? And now we're going to get into associated points, not directly. So first we had the eye, then we're scanning the optic nerve, all the tissues around the eye. Now the next point is the carotid artery on the neck. So this is that place where you feel your pulse. And with coMra therapy, you saw the picture earlier, you don't have to be pinpoint accurate. So you don't have to sit here for 10 minutes, go where exactly. Picture crosshairs on the delta, up and down. You're aiming for the center of that to be where, let's say when I'm treating my eye, this is off right now, that's why I'm looking. I'm aiming for the crosshairs to be in the center of my eye. If I'm treating somewhere else, on my neck, this carotid artery, just the general area is fine. And whenever you treat this area, this increases the blood flow to the eye without increasing the pressure. It'll actually lower the pressure. So it helps get the nutrients in and the toxins out. Also, whenever you treat these arterial points, there's loads of lymph nodes in here. So you're also addressing the lymph system. And this is very important because toxins that come out of cells need to get somewhere. And part of that is the lymph. So we have the lymph system. Now you'll see a point here in the solar plexus. I won't go into too much detail about that, but that's a supportive point for treating your eyes. And on the back, you're going to see an adrenal treatment, okay? This is very important. And again, a supportive treatment. These are those systems that are supporting the local eye health. And I'll get into a little bit more later about systemic and local treatments and why they're so important, especially in a home setting. In a clinic, you're going to have to do as much treatment as you can in the time that the person's there, but you're limited. Home setting, much different. So we'll get into that a little more. So that's basically a treatment. Now, there's one other thing I haven't talked about, and it says twice daily until significant improvement is noted. So this is going to be something, this is where you enter the picture. And of course, you have your doctors and your therapists that you're consulting with. They can also support you in determining when improvement has been noticed. And when it comes to a really chronic, degenerative, long-standing condition, generally we say, look, treat for several weeks, take a break, because remember what I said earlier, the body has the intelligence, so we want to support it. So we treat and take breaks for the body to adapt to the support given. I kind of look at it like you put the training wheels on the bike and then you take them off to see if the child is starting to get its balance. So you see if the body is starting to get its balance. Excuse me. And then if you notice that starts to go down again, put the training wheels back on. In other words, do the treatments. But as I was saying, in a severe chronic degenerative condition, you may need to just keep treating and not take the breaks, because as you see below the twice a day on the page, it says treat for that period of time, take a rest for some time, and then come back to it. This is in most of the treatments, but not always. One of the things I didn't mention earlier about the user guide that's worth mentioning right now, and this is part of those tidbits and tips I said I'd bring in. This is a general middle of the road starting point / guidelines, and we say treatment guide, not treatment manual. In other words, it's not prescriptions. These are just to help you along your way. So why I say conservative middle of the road is it's inherently safe. Anyone can pick it up and do it and no problem. Some people do not like to deviate from the book. Other people don't want to use the guidelines. They want to fly on their own. And of course, as people gain experience, they need to book less and less. So you're going to have to determine that for yourself. The coMra training course is there to help you get the most out of your coMra therapy, your Delta device. There's support, that's also there. So you'll have to gauge yourself, and I'm really talking about a lot of things that don't really come into play for everyone. I just like to, well, I'll just like to cover a bunch of broad bases here, tidbits, so then if you should move forward with coMra therapy, there are little seeds planted so you'll know, oh yeah, okay, Garrett said this, okay, he was talking about that. And you can always follow up with us about, hey, I remember this, and we'll move forward with you. Okay, so now we looked at the eye treatment itself and some of the supporting treatments that are actually in the eye treatment. Let's have a look next at customizing treatments. Now, there's a lot in the coMra therapy online courses that goes into this in a lot more detail. So here I'll just glance over a few things. We'll just look at a few things. Really, the customizing treatments is about which organs are involved. So, well, we'll use the eye. We've been talking about the eye. So the organ of vision is involved, okay? Part of that is the visual cortex. So that's why it's part of the treatment. Then another part of that is this optic nerve, and this is why the scanning is there, because those radiances are penetrating in to the head, to the optic nerve. And then the supporting systems directly supporting the eye is the circulatory system, the blood, and that's why these carotid artery points. And there's more to it because there's an interface with your nervous system here, and there's all of these things that go into picking the points. Because this comes from, remember in the last presentation in Russia, so there's like 50 years of research and clinical experience to decide these points being treated. And with coMra therapy, we've just taken that to the next step because a lot of times they're local, but we're looking at, well, these are the supportive systems. We need to include these because if you think of a cell, think of an organ of vision, your eye, this is not an island unto itself. Obviously, it's connected to everything else in the body. And we want to support, if I may use an analogy, if you have a person in the community who's in trouble, you need to support not just the person, but if you support the whole community, that community can also support the person. And when we talk about holistic self-sufficiency, when we talk about the intelligence of the body, we move past this compartmentalization where we start to address the whole, and the whole will resolve the part, like help the part heal. So this is the local and systemic and relates to the customizing treatments. And the other thing, we picked the solar plexus point, is very related, and the adrenal glands that I mentioned. Why we're picking that, if I could say it very, let's say, succinctly, if the body is in such a stressed state, we're burning up all our energy in fight or flight, we'll just say very simply. We need to be in a more relaxed state to have the energy available to heal. So treating the adrenal glands, treating the kidneys, all of these things, this is putting the body into a more balanced state where healing is more efficient. So this is what we're doing with customizing treatments. Now, the other aspect of customizing treatments is when a person has, let's just say for argument's sake, they have, or for the sake of an example, they have vision challenges, they've got digestive challenges, they've got joint challenges, and they've got, we'll just say, challenge with their heart. Okay, so they've got a lot going on. So how to treat all of those things, and this is where customizing treatments comes in and can be easily done. Again, you learn this through the course, because one of the things we're going to see, I'm going to talk about it right now because we're talking about it. Actually, let's go to the next slide. This subconjunctival hemorrhage, okay? So this is a blood clot in the eye, and the treatment done there was treating the eye. Now, if you ask me, I would also recommend treating the carotid arteries because, of course, this increases the flow of blood to the eye without increasing pressure. So this is very good because think of more oxygen in, better health, more toxins out. But the thing interesting here, this patient got to take the Delta with them, because the recommendation was any acute condition is to treat it many times a day for a very short duration of time. Think of it as, you put a little bit of water in the cup. It's a small cup. You just put a little bit in at a time. If a person's in shock, for instance, let me use that example. You can't give them a big chug of water. It's not good at all. You just wet their lips. So it's the same with an acute condition. Just small multiple treatments will resolve things very quickly. So in this case, the specialized approach to customized treatment was to increase the intervals of treatment, and the patient got to take it home. Now, I don't know what kind of relationship you have with your patients or you have with your healthcare providers, but this is obviously a very good one. So this is a very simple example. Just treat locally, and then the next step out would be you could support, because it's blood related, you could support by treating the carotid arteries. You'll see here in the slide, he used the delta and 50 hertz. Now notice here, ultrasound is on, and had this done 4 times a day, and of course we'll see how that progressed. This is an example, and why I'm showing you this is, well, a resolution of that natural healing process in the body and increasing the efficiency of it with coMra. 2, because we're treating the eye, so a problem occurs, a challenge is happening, we treat it directly, the volume of tissue affected. And then thirdly, to show an example of it's not exactly as is in the user guide. In this case, what happened is, they went off plan, so to speak, to increase, because it's an acute condition, multiple treatments per day, very short duration, as you can see here, 2 minutes. Okay, so let's look at the progress. You can see before he started, and then you see 1 hour after the first treatment, you can see that blood clot resolving itself. And then 1 hour after the second treatment, which is 7 hours after the first treatment. And so you can see this progression. I'm not going to read them all. You can look at it and watch the recording. So in less than 48 hours, that hemorrhage has been resorbed. And this usually a process takes 2 to 3 weeks. And this is that natural self-healing of the body that's happening all the time, but often it needs that support to increase the efficiency so that it can meet the demands that we're under in these conditions we live in today. So that's a simple example, bringing in a few different aspects. And now let's go to the next slide, and we're going to look at glaucoma. So now this is a lady in her 50s. I won't go into all the details, but the biggest part of this is interocular pressures raised and drug complications, meaning allergic reactions to drugs. So this is brought in to look at, because here we have something that's let's say a side effect of medication, and what can we do with this with coMra therapy? Now, what did she do for treatment? And again, this is a case where the therapist, the doctor, and the patient relationship, they allowed them to take the delta home to do the treatments. And you see here 48 treatments done over 28 days. So this is more than 1 treatment per day on a lot of days. And in the book, we also say 2 times per day. So not much deviation from the book, actually. And then about 20 minutes per treatment, and neurology 14 was done, and this is the one we've gone over. Now, why I wanted to show you this one is obviously because the results, and we're again showing this efficiency, increasing efficiency of this natural healing ability in the body, but also because if I had my say, let's say in this situation, I would have recommended more treatments besides just the neurology 14 treatment. Now, what kind of points? Well, if we consider things to do with allergies, we're going to start to address the immune system. And so there's treatments we would bring in from the universal section, and you can see them here on the screen. One really good one for recuperation from illness is Universal 4. So we're going to get into that a little bit more, but you can see it here on the screen. If there's time, we'll get into it more. And what this treatment is designed to do is to support and speed up recovery from illness, because a lot of the internal organs, well, all of the internal organs, because it's one big system, are going to be related to how much the body can heal, how efficiently it can heal. So this would be one aspect. Another one, anything to do with rashes and things like that. Again, we come back to circulation, so the blood, and you can see another universal treatment here on the screen. That's going to be very helpful because, again, nutrients, oxygen in, toxins out, it starts to alleviate the issues going on. So this is the treatment done. This is a couple of points about why, and then of course, excuse me. There we go. Pressures come back down to a very good level, never been so low. They had a lot of complications, lots of different drugs, the laser trabeculoplasty. Still big challenge with eye pressures, so they got normal. And the other thing is, of course, the skin rash is gone. She's very happy. And those visual fields improved and opened up. So when you think about that, excuse me, the intraocular pressure, this is pressure on that optic nerve, and this is damaging nerve fibers. But if nerve fibers are still alive, they can be damaged and not dead, then that self-healing ability of the body can be, let's say, kicked into high gear, increase the efficiency of that, and it can resolve things, it can improve conditions, and if it's a really severe case, it can maintain so things don't get worse. So again, we come back to the importance from a number of different angles of presenting this to you. Obviously the outcome, but also suggestions of different things that can be done, especially in a home setting. Again, in a clinic, time is limited, so these relationships allowed that the person could take it home. And let's see, yeah, we'll stop there because we want to move on to the next case, and this is going to be a case of retinitis pigmentosa. So again, we have some complications with the case. It's not just a straightforward one, and we'll look at treatments done and make some suggestions of what could be added. Okay, so this next case we'll look at is from Dr. Lori Chaikin, and what we're looking at here, why we're presenting it, is it's not only retinitis pigmentosa. This individual also has a history of HIV and diabetes. So again, we come back to limitations in office of what can be done for treatment, excellent results within those limitations, and then I want to just introduce the idea, or reintroduce, or keep bringing back this idea of this, let's say, at-home treatment so a person can do more and more to look after themselves. And let's go through the case. I'm going to start with the slides, and I'm not going to talk about every point on the slide. I'm just going to talk about a few main ones, and you can read whatever you need off the slides from there. So let me just, there we go. So like I said, 57-year-old female. Now, one of the things going on for this lady is she couldn't see, couldn't step off a curb very well, banged into objects all the time, and really difficult adjusting going from dark to light or light to dark. This is that contrast sensitivity. Like I said, history of HIV and diabetes type 2. Her vision, well, okay, 20/30. You can still drive with that, but you cannot drive with the contrast sensitivity problem she has. She doesn't see anything at certain spatial frequencies. In other words, the distance between the dark and the light, and very depressed at different frequencies. So her contrast sensitivity, couldn't drive. Also, her visual fields were in such poor shape, she had tunnel vision, she couldn't drive. Okay, and color vision moderately impaired. We're not going to get into the OCT and the ERG. You can read that, like I said. Now, she'd started doing treatment with just microcurrent, Dr. Chaikin did, and then she said, hey, I'm going to incorporate coMra because she was new to it at that point. And so the patient said, look, with the microcurrent, I'm starting to feel better. I feel like my peripheral vision's increasing. And sure enough, the visual fields reflected this when they were tested. And then later they added in coMra therapy, and the treatment's done. Let me go to that slide. I'm kind of skipping around a bit.
This is her initial visual field that I took with a stereocampimeter. So this shows a very small field of about 10 or 15 degrees. So about 15 degrees lengthwise and about barely 10, maybe 7 degrees widthwise. That's the right eye, and the left eye is showing a little bit more, so maybe about 15 degrees laterally, horizontally, and about 10 degrees horizontally. Our first treatment consisted of microcurrent, because that's what I had been doing and was very familiar with. 5 treatments only, once a week, 37 minutes duration. And after about the 5th session, she started to report she feels like she can see with more confidence. We remeasured the visual fields, and to just show you right eye comparison only, this was before and this was after the 5 treatments. So this is at day 1 and day 18, right eye only. And then left eye comparison, day 1 to day 18 of the left eye here. So really significant improvements already. At that point, I started to add the coherent multi-radiance laser. We did 14 sessions of combined coMra and FSM, the microcurrent. The coMra protocol was initially, so I was varying the protocol as I was doing field tests, and I decided to do more and more as I went along, kind of developing the protocol. So in the beginning, I did just universal 1 with 1 minute lateral aspect of the eye, with the eye looking in towards the nose through the closed eyelid. Then I added the optic neuritis protocol, which is a scanning protocol, starting with the placement right at the temple and then moving the device above and below the orbital ridge. Then I added to that 1 minute lateral, 1 minute superior with the up and down gaze, and ultimately 1 minute of the universal 1 plus the optic nerve protocol, 2 minutes plus 1 minute lateral, 1 minute superior, and all of them were scanning, meaning that I was continuously moving the device. So these are her visual fields. Let's see, that was probably about a month, did them at 1 month intervals. And then 1 month after that. So you can see there's a huge expansion. This is again the right eye. So we've got about 40 or 50 degrees of field looking along this way and about 40 or 50 here. And also a very nice expansion before. This is the blind spot. And they're a little bit larger than normal, but at least she has one. And that's a normal blind spot. That's where the optic nerve exits out of the back of the eye. So large expansion in the left eye as well. Then August, continuing to expand. The field is changing. In some areas it almost seems like it's a little bit, but in other areas it's a little bit more in each eye. This is the test of contrast sensitivity in the before condition. The red is the right eye, the green is the left eye, and the normal range is this shaded area here, so severely below normal. And then at the final testing in August was all within normal range, which is just stunning. This was the Goldman field that was done by UCSF before and after. And what she had initially was just a tiny target, a 1 millimeter target, is this area right here. They also did a 4 millimeter target here initially, right eye before and then afterwards. So this is the corresponding 1 millimeter area, and this is the 4 millimeter target. So this is an external documentation of improvement. And then this is the left eye. This spot here was the 1 millimeter target. Left eye before, 1 millimeter target, 1 millimeter target after, and the 4 mil target before, 4 mil target after. So again, documenting externally, huge improvement.
So they did 14 sessions of combined coMra and frequency specific microcurrent. Now, another bonus with coMra, like I said before, it'll dovetail into all other types of therapies you're using in your practice. Or if you're at home and you're taking a holistic approach, all of those things are going to work together. So, and coMra and frequency specific microcurrent are excellent together for eye conditions, as this case clearly demonstrates. So, we had 14 sessions of combined coMra and frequency specific microcurrent. Now, initially she used universal 1, you can see that here on the screen, and then started to add more points in, as you see here. So this is this adaptation of the treatments until finally she started to treat the eye, and you can see the visual fields really opening up here. Now, this person went from couldn't drive to can drive, because not only did the visual fields open up, but also her contrast sensitivity went from very poor, as you see in the description here in the test results, sorry, and you can see from what they were to inside that gray area means that she's good to go for contrast sensitivity, or almost normal. So huge quality of life improvement. Now there's a lot more again that could have been done in this case, but time is limited in office. So definitely recommend we come back to a systemic treatments, and we're going to get into that next. We'll look at them specifically. We'll just go through them. But definitely recommend systemic treatments, because and to directly treat that diabetes. Diabetes slows down all healing processes in the body. So whether it's type 2, type 1, borderline, we still need to address the impact on the body, because it's going to address the eye, or it's going to impact the eye health. So we're addressing the supporting, surrounding, interrelated systems in order to maintain and even improve eye health. And in this case, definitely improve. Now, as another note, after they finished the treatment courses, her vision started to deteriorate again, and so they had to continue the courses to try and get the visual fields back up. But again, there's a huge advantage to being able to treat at home in order to maintain and keep getting improvements in vision. So let's move on to the universal treatments. Okay, so you've been hearing me use this word universal treatments, local and systemic. So let me explain a bit more what I mean by that. When we talk about a local treatment, this is treating the eye directly is a local treatment. In other words, you're treating the damaged, injured, ailing tissues, cells directly. So if you had a liver issue, you'd be treating the liver directly. Okay, so that would be a local treatment. Now, a systemic treatment means we're talking about the central nervous system, we're talking about the endocrine system, we're talking about the blood or the circulatory system, we're talking about the lymphatic system, and this is the one that gets the toxins out, and it's part of the immune system, a big part, and we're talking about the internal organs. And all of those play a role in the functioning, the health, or the ailment, the deterioration of every single cell in the body, both the cells that are part of the system itself and the associated ones. So let's say, if you got very poor gut health, your immune system is going to be low, so maybe you got sinus infection. So you're treating the sinus, but you still need to treat the gut. So same with the eyes, in Chinese medicine, the liver is linked to the eyes. So some people, when they're doing the treatments, they include the Chinese medicine perspective as well. Now, when we say universal treatments, these are the applications, the practical application of this systemic approach. And I'm not going to go through all of them. I'm going to just talk about the three main, most popular ones. That's Universal 3 for blood and lymph, Universal 4, which is the internal organs, it targets the central nervous system along the spine, and also aspects of the endocrine system. Now, the endocrine system is part of the hormonal balance system. So it regulates all the, let's say, biochemical processes in conjunction with the immune system, with the nervous system. All of them work together. I mean, like I said, most sophisticated uh, technology on the planet, our bodies, though not just a machine. It's a, life form in its own right, so to speak. So those three treatments, Universal 3, Universal 4, and then Universal 5, is really if anybody has a nervous system based condition. So let's say you're really stressed out and you knew for a fact this is relating to your eye problems, then this would be the treatment. Whereas if you felt very physically weak, Universal 4 would be the go to. So there's a different approach. Again, we get into this a lot more in the training so people can learn more about this. I'm just touching on it here today, and you've seen the images of the treatments come across the screen here. Don't forget you can download them at the link. So that's about it for universal or systemic approach. Again, you can do either or, but we'll always recommend both for that holistic approach. Okay, so now let's look at diabetes, and the reason we're going to look at that is because this next case of diabetic retinopathy, it's not just an eye condition. I mean, it's obviously diabetic retinopathy. The eye condition is the direct result of the complications with this other disease in the body, which is diabetes, and the treatment of that and what was involved in that treatment. And so now, when we look at this case of diabetic retinopathy, proliferative, which means it's really severe, this is where we come into combining treatments in a bigger way, because obviously this person had diabetes or has, and this is what's causing the eye condition. So we're going to look at this in terms of, just go through it very briefly. 63-year-old female. Now, she's there because her vision is so poor, her family has to lead her around. She can't move around anymore. She's got hypertension. They're dealing with that with medications. She's also had her gallbladder removed 9 years ago, but it's really the severe limitation on her life due to inability to see. So this is why she's seeing Dr. Pena. And so the family had to take her around, and her quality of life really went into the toilet. And with that, as all of us, irritability, moodiness comes up, and that's really having an impact on her and her family. So I won't go into the details of all the medical aspects of it. They're here on the slides. You can read them, pause it as you need to. The main thing is she's in rough shape. What I do want to talk about is her visual acuity, okay? So in her right eye, she can perceive light. That's it. So she can't tell who anybody is. She can't see anything. She can't feed herself. She can't do the things around the house. Nothing with this right eye. Left eye, count fingers at 50 centimeters. So 50 centimeters, about right here, she can count fingers, okay? Actually probably about right there. This is very reduced vision, and she's got other complications because she's, like I said, she's got the diabetes. Now let's look at the treatment protocols done. So Dr. Pena, he's an integrative doctor, so he's using microcurrent, he's using coMra therapy, he's using Chinese herb, lots of different modalities he brings together. Even though he's a medical doctor, he does a lot outside of the box, so to speak. So coMra was a part of that protocol. So anybody with a practice, coMra will work very well to potentiate, let's say if you're doing homeopathy, it'll potentiate homeopathy. Obviously we've talked about microcurrent and coMra, so they work well together. So the protocol used for coMra therapy was really that diabetes treatment I showed you, where you're treating the pancreas, okay, and a few other points on the body. Now, because it's in clinic, Dr. Pena really focused on right here on the stomach and treating on the back. You can see on the diagram along the spinal column, because all the nerves emanate from there and go around the body. And so you treat that to treat that peripheral nervous system that innervates that area as well. It's part of that organ system and interrelated. So we done those treatments, and you can see here 2 times a week for 12 weeks. Again, all practitioners, this is your limitation. You can only see people on a limited basis. The advantage for the home users, if you can encourage people to take that step for themselves, who are ready to take that step to take responsibility for their own health and really, take the horse by the reins, so to speak, for themselves with your guidance. coMra therapy is going to be a great addition to your practice for that, as well as in-office treatments, of course, because not everybody's going to be able to afford it. And so, and this for you home users who are watching this, considering getting coMra therapy, you can do a lot at home without having to leave the comfort of your own home. Or when you travel and go places, you can take it with you to stay on top of treatments in terms of, look, some people really, they don't want to go anywhere without their delta. And I get that quite common. It goes along with that story of I didn't know I could do so much to look after my health, that one I said at the beginning. So with this, you can incorporate coMra into your lifestyle very simply. But now back to here, the doctor could only do so much of any treatment protocol in the office. So he did the diabetes treatment protocol, and he did basically universal neurology 14 without the scanning. Did the eyes, he treated stationary at the temples, did the occiput, the visual cortex back here, and the carotid arteries. Now, he had the ultrasound on for the eyes, off for the visual cortex. I'm going to show you if there's time. Actually, we won't have time. Anyway, we'll get to it at the end. I was going to show you a different case, but we won't have time today. So these are the treatments done. I won't go through the technical of the results, but the biggest thing is, think about it, light perception only, okay, in that right eye. And now she could see hands in the right eye at a full meter away. That was better than her left eye when she started. A full meter away, which is, for you in the US, this is just over 3 feet. And then for her left eye, went from, being able to see fingers at about 50 centimeters, half a meter, to now able to see 2400. That's the big letter on the chart at 6 meters or 20 feet away. Those are astounding improvements. Dr. Pena was really impressed. And so this is an example of combining treatments, of the support of those other systems. And one of the, with the hypertension, this can also be addressed. But again, in a home situation, you can tackle so many things, whereas in a clinic situation, you're limited to do a certain amount of time. Home, you have a lot more time flexibilities. So very important improvements, especially in the left eye, according to Dr. Pena. And again, this demonstrates how the body heals itself, knows how to. It needs the proper support. They didn't go in and try and replace the eye or do anything crazy. They just supported what was there, the damaged cells, so that they could regenerate themselves, repair themselves, improve their efficiency, so that all their functions improved and thereby start to rebuild. But now when it comes to this rebuilding structure, this takes time. It's not a pill for an ill, boom, magic bullet, and it's all done with one treatment. This is an investment in yourself over time. All your professionals are well aware of this, but for home users, this is really about an investment in yourself over time, because, and I'll apply this to, let's say, as the body ages, it's not going to have the same, let's say, efficiency of that self-repair process, of its inherent ability to repair itself and heal itself. It's happening all the time. If it wasn't, we'd be dead a lot quicker. So this is happening all the time, probably despite many of our lifestyles. And so we can turn that around in our benefit to our in terms of supporting the body. And coMra can be used not just for when your back is up against the wall and you're about to lose your driver's license and all these things are happening, and your quality of life is deteriorating rapidly because you can't see. You can use it preventatively as well. So let's say you had to go for a surgery, you can use it before, and the outcomes of surgery will always be better. You can, if you had to go for an x-ray, you can treat with coMra before, and the effects of the radiation are reduced. So if you have osteoporosis, these kinds of things, it's not going to be as detrimental to you having to get that x-ray. I'm pointing this out because all of this relates to that as we age and how the body can't keep up with all the impacts and injuries and insults and toxins that are impacting it. And so coMra can become an integral part of that. Same with you're feeling down, you're feeling low, you want to stay healthy. Like I said before, there is no ceiling to health. So rather than waiting till our back is against the wall, coMra can be an integral part of your life to look after yourself before it gets to that point. So let's go on to the next slide. Okay, so now let's we'll call this the end now because we've gone through a lot of material. There's still tons more we could go through, but we've already, like I said, gone through a lot. And I want you to, if you're ready to go for coMra, here I'm putting a discount code for those people who stayed through the whole workshop. And for those who aren't quite ready but have more questions, my email is here. Write me an email, sign up for, I'm going to send out more newsletters, and the pieces we couldn't get to in here, more eye cases for real life examples, those will go out periodically to anybody who signs up, and some more coMra related information. And obviously if you have any questions, comments, concerns, or queries, we'll look after those in the email. We can have telephone conversations as well. I often like to speak on the phone. We can cover a lot of bases that way. And for those who now is not the right time, no problem. We're always here ready to, if you have any questions or you want to explore anything at any time in the future. And I want to thank you all for joining. Really, coMra therapy is, at the end of the day, as I said at the beginning, it's really about that phone call. I didn't know how much I could do for my own health. And this is what we're offering you with coMra therapy, to be able to be a much, I don't know how active you are with your own health in terms of things you do to look after yourself. Obviously you do quite a lot if you're even watching this video. So kudos to you. We're here if you want to take even more steps in that direction in a very simple and easy to use way with coMra therapy. And above all, no matter where your path takes you, we at Radiant Life Technologies wish you the very best of health and the very most of life. Thank you.